So Los Angeles, it probably already was having issues with this drug, but it is now more evident than ever before that fentanyl is really hitting Los Angeles very hard. And so fentanyl scourge plainly visible on the streets of LA. So this article, it talks about the seizures, things like that, that they've been having, the problem they've been having with fentanyl. So LA, in a filthy alley behind the LA donut shop, Ryan Smith convulsed in the grips of a fentanyl high, lurching from moments of slumber to bouts of violent shivering on a warm summer day. So when Brandis Josie, another homeless addict, bent down and blew a puff of fentanyl smoke his way in the act of charity, Smith sat up and slowly opened his lips to inhale the vapor as if it was a cure to his problem. So fentanyl is now the most common drug here in Los Angeles. It is like the new crack. So Smith, wearing a grimy yellow T-shirt, said that good vibes only. We, he says that he reclined on his backpack and dozed off to the rest of the afternoon on asphalt, unperturbed by the stench of rotting food and human waste that permeated the air. So you have a lot of homelessness here. There's you'll see like homelessness. It just is growing and growing and growing with the inflation, the high rents, the layoffs, and homelessness crisis is gotten worse. It is getting worse. It is not getting any better. And it's not just in California, it's not just in Los Angeles, not just in certain parts of California. It's spread into other states too, and I've seen it. It's really bad. So for too many people strung out on the drug, the sleep that follows a fentanyl hit is permanent. And so the highly addictive and potently lethal drug has become a scourge across America and is taking a toll on the growing number of people living on the streets of LA. So nearly 2,000 homeless people died in the city of LA from April 2020 to March 2021, 56% increase from the previous year, according to a report released by the LA County Department of Public Health. Overdose was the leading cause of the death, killing more than 700 people. So fentanyl was developed to treat intense pain and ailments like cancer. So the use of fentanyl, a powerful synthetic opioid that is cheap to produce and is often sold as is or laced in other drugs, has exploded now because it's 50 times more potent than heroin. Even a small dose can be fatal. And so just the smallest dose, and it has quickly become the deadliest drug in the nation according to the Drug Enforcement Administration. So two-thirds of the 107,000 overdose deaths in 2021 were attributed to synthetic opioids like fentanyl. So the U.S. Center of Disease Control and Prevention has said this. So the drug's toll spreads far beyond the streets as well. So Jennifer Cantano, 27 years of age, the names of two children tattooed on her wrist, but she hasn't seen them for several years, so they live with her mother. So my mom doesn't think that it's a good idea because she thinks it's going to hurt the kids because I'm not ready to get rehabilitated, Cantano said. So this is a huge problem. So she has overdosed 3 times, has been through rehab 7 or 8 times. So it's scary to get off of it, she said. The withdrawals are really bad. So Cantano wandered around the subway station near MacArthur Park, desperate to sell a bottle of Downy fabric softener and a Coleman camping chair she stole from a nearby store. And so that is how bad this drug has got people so desperate that they're willing to steal and probably even hurt people. And sell their body or sell whatever items they have just to get this drug. So Cantano wandered around the subway station of MacArthur Park, and MacArthur Park is pretty dangerous at night. Um, I don't think it always was like that, but lately, since it has a lot of homeless people that are over there, a lot of people that are on drugs, such as what you're hearing in this story, it is not the place you want to be after dark. Um, I would also say, even in the daylight, you got to be careful. So, drug abuse can be a cause or symptom of homelessness as well. So, both can also intersect with mental illness too. In 2019, the report of the LA Homeless Services Authority found that a quarter of all the homeless adults in LA County had mental illness, 14% had a substance abuse disorder, and that analysis only counted people who had a permanent or long term severe condition. So, taking a broader interpretation of the same data, the LA Times found about 51% had mental illness and 46% had substance abuse or substance disorder. Um, so it it's really bad, and so I've been seeing a lot of stuff that's been happening. So billions of dollars were spent our billions of dollars are being spent to alleviate homelessness in California, but treatment is not always funded. And so, a controversial bill signed by Governor Gavin Newsom could improve that by forcing people suffering from severe mental illness into a treatment facility. And so, I saw articles saying that they have places now set up, hospitals that are supposed to take people in with severe mental illness, but they need to be diagnosed with a certain disorder such as schizophrenia, and addictions alone doesn't qualify you. So help is available but is outpaced by the magnitude of the misery on the streets. And so it's even dangerous now, where it used to be, homeless people you see now. I know not everybody is bad, but there has been some homeless people that maybe if it's associated with mental illness, that there has been some violent attacks from some people who are homeless, that maybe they're mentally ill, maybe they see something, or they might be high on the drugs, and the drugs might have a role in the behavior. So Rita Richardson, a field supervisor of LA Door, a city addiction prevention program that works with people convicted of misdemeanors. She hands out socks, waters, condoms, snacks, clean needles, and flyers at the same hotspots Monday through Friday. So she hopes that the consistency of her visits will encourage people to get help. So then hopefully the light bulb comes on. It might not happen this year, but it might happen the next year. It might happen several years down the road. This is said by Richardson, a former homeless addict herself. So my goal is to take them from the dark to the light. So parts of LA have become scenes of desperation, with men and women sprawled on sidewalks. So now I'm not just making this up. This is what I have seen, and this is not going to sound pretty. This is almost the end of the story, but this is not going to sound pretty. So this is what I've seen, and I have to agree with this. I've seen this where parts of LA have become scenes of desperation, with men and women sprawled on sidewalks, curled up on benches, and collapsed on in squalid alleys, and some huddled up and smoking a drug. Others inject, they're huddled up smoking and drugs and doing the drugs, or others are injecting the drugs. So Armando Riviera, 33, blew out white puffs up to attract addicts in the alley where Smith was sleeping. And so he needed to sell some dope to buy more dope. Okay, so you even have drug dealers who take advantage of the situation. So those without enough money to support their habit hovered around him, hoping to get free hits, and Rivera showed no mercy, so Cantano couldn't sell the chair, but eventually she sold the fabric softener to street vendor for $5, and so it was enough money to get another high. So this story has been updated to correct the spelling of the Downy fabric softener. So I guess they have to clarify, their writing or whatever. But anyway, yeah. So it is. I thought this pretty much says what's going on here in LA County, and it's not just LA County. I've been seeing it in other places that are outside California where drugs, or it's like this desperation. You see all of this stuff going on where people are homeless, and it's like happening everywhere. It's like a cancer that just won't end, and it's spreading to all the different states. You starting to see people complaining about the rents because they're getting laid off on all these jobs, and so this stuff is not good. This is around the holidays that this stuff is happening, so this is pretty serious. So it's like, what do you do when you like feel like there is nothing else? There's no help. You're trying to find support and stuff, and then the lines of people trying to get free turkeys and stuff this year. Ooh, those lines was long because everybody, everywhere, seemed like a lot of people was needing help. These are the drugs that are hitting the streets of LA County, and so it's like really bad, y'all. So I know this story ain't a really happy story, but none of these stories, but it just keeps you alert at what's going on, that you see how it affects so many and how it gets so close to home. You start paying close attention to it because you start thinking, oh, okay, well, how's my job situation? Is it stable? Is the company stable? And they having money problems and stuff like that. So now it's starting to make people think, places you thought were secure jobs may not be as secure as you thought they were. So and some of the jobs that you see that are just open and they're hiring, but you don't see nobody wanting to be there, that should tell you something too as well. So it's just something to think about.